last session, we have studied about the human circulatory system, in which we have studied the external, the internal structure of the heart, the walls involved in it, and the blood vessels associated with it. So today we are going to learn the disorders of the circulatory system. Disorders of the circulatory system. So there are many circulatory system diseases, all of which interrupt this complex process of distributing the blood around the body. So in the session, we'll learn about the disorders of the circulatory system. First one will be your hypertension. Hypertension is high BP. Hypertension is high blood pressure. Talking about this high blood pressure, we call it as hypertension. So it is a force exerted by the blood against the walls of the vessels. So it is affected by age, sex and state of health. So blood pressure is measured in the branchial artery of the arm by using the sphygmomanometer. So if you take the normal blood pressure, it is 120/80 mmHg. This is the normal BP level. The normal level is 120/80. So if it's going beyond that, you say it is hypertension. So the upper reading pertains to systolic pressure and the lower one will be the diastolic pressure. So the blood pressure which is above 140/90 is considered to be hypertension. So it is worth knowing that it is universally believed that excessive intake of salt causes hypertension. That is in addition to the genetic reasons. So one of the reasons for this is the blocking of arteries by cholesterol. So if the level of the cholesterol rises in the blood, it gets deposited on the walls of the arteries. So what's happening? The arteries will become narrow, stiff, and they lose their elasticity. So when this happens, the arteries cannot exert their moderating influence on BP. As a result, there will be a rise in BP. The blood flowing in the arteries exerts a peripheral pressure on the walls of the arteries. I hope you understood what are the causes for the high BP and what is the normal and what is the abnormal level for this hypertension. Now, this constant stress and strain for a long time, improper functioning of kidneys, smoking and alcohol consumption are also the reason for hypertension. So this condition, if not treated for a long time, may also lead to the severe other health problems and they lead to the death of the person, of course. So how can you prevent this? The main thing, you should have a good diet control, you should have a moderate exercise, the stress and strain should be avoided. The smoking, alcohol consumption, all should be reduced, and taking the appropriate medicines will help to control this problem. Fine. Now, secondly, talking about the coronary artery disease. Coronary artery disease, you otherwise call it as atherosclerosis. You call it as atherosclerosis. So atherosclerosis, it affects the vessels that supply blood to the heart muscle. So it is caused by the deposition of calcium, fat, cholesterol and fibrous tissues, which make the lumen of the arteries narrower. This means the blood vessel will reduce the blood flow to the heart, which causes ischemia, that is the restriction of the blood supply to the muscle tissue, causing the shortage of oxygen. So this myocardial cells may die due to the lack of oxygen, and this is called as a myocardial infarction as it leads to the heart muscle damage. You call it as myocardial infarction. So that will lead to the heart muscle damage. So what are the risk factors involved in this? There are smoking, family history, hypertension, there is obesity, diabetes, high alcohol consumption, then lack of exercise and stress. So we have talked about this atherosclerosis, and next one talking about a condition called angina pectoris. Angina pectoris, it is a symptom of acute chest pain which appears when there is no enough oxygen reaching the heart muscle. So this angina can occur in men and women of any age, but it is more common among the middle-aged and elderly people. So these people having this disease, that is the angina pectoris, may also feel breathless, tired and nauseated. Nauseated, they'll have that sensation of vomiting. So that will call it as nauseated. This is angina pectoris symptoms and all. And finally, talking about heart failure. Talking about heart failure, it means the state of heart when it is not pumping the blood effectively enough to meet the needs of the body. So it is sometimes called as a conjunctive heart failure because there will be a congestion in the lungs, which is one of the main symptoms of this disease. So the heart failure is not the same as cardiac arrest when the heart stops beating, or a heart attack when the heart muscle is suddenly damaged by an inadequate blood supply. So if blood supply to the portion of the heart muscle is cut off entirely, or if the energy demands of the heart becomes greater than its blood supply, a heart attack, that is an injury to the heart muscle, may occur. Okay, thanks for now. Next session will deal about the cardiac cycle and ECG.